So initially in 1994, we started the program as an inpatient program. In 1996, we moved the program to outpatient setting. When the patients are in the hospital, it is, you spend about 6 to 8 weeks, or maybe even 4 to 6 weeks in the hospital. And you are in a private room, isolated from rest of the patients. And it is very, very hard for somebody's psyche to really undergo massive treatment with no support or limited support from family members and nurses and their other co-workers. However, and I think the risk of infections also in the hospital are significantly higher. When we moved the program to outpatient setting, we were a bit courageous at that point. However, we found that the patients really did extremely well. Majority of the patients start the program as outpatient, and they do end up in the hospital either during their period of low blood counts because of a fever, infection, dehydration, or bleeding complications. But the length of stay is usually only 4 to 7 days. And I think that really truly helps the patients, and they are in their own home setting as well as with their own family members, and we see them in the day hospital, which is they spend the whole day in the clinic or the day hospital from 8 o'clock in the morning till 5 o'clock. We could provide intravenous fluids, blood transfusions, platelet transfusions, antibiotics, and other symptom management in the day hospital. And I think we take great pride in actually having this as outpatient, because I think the patients do much better, and as far as even deconditioning is concerned, that tends to happen in the hospital.
This excerpt is brought to you by the Massachusetts School of Law, the leader of reform in legal education and a leader in multimedia education for the public. To view the full interview and for a full listing of MSL's programs, log on to mslaw.edu.